So thank you very much for having me today, and thank all of you for still hanging in there. I'm impressed. We may have to jostle your seat here in a few minutes to make sure that you can hang in all the way to the end. So I'm going to be talking about screening and lifestyle behaviors, and what are some of the ways that we can promote them so that consumers will do them and will do them in a willing way. Once someone's been diagnosed with cancer, and I have been diagnosed 3 times, I'm a 21-year breast cancer survivor, then diagnosed again, same disease, opposite breast, 19 years ago. Then 7 years ago, I was in the hands of GYN oncology. So I'm working my way down, and I told my husband when I get toe cancer, then I know I'm all done with this stuff. But once diagnosed, and it doesn't matter if we're in the profession, not in the profession, if we're a ditch digger or a school teacher, there's an element of foxhole religion when you hear those words, you have cancer. And it's an opportunity that we can grab hold of with our patients and sit down and have a conversation with them about the rest of their family, because they're now worried about not just themselves, but everyone that's related to them. They might even show some interest in a few of their in-laws. And so in learning more about that family, and I think this is a perfect role for a nurse navigator in saying, tell me, do you have siblings, do you have children, are your parents still alive, et cetera, and you're getting that cancer history from them. You also have the opportunity to be saying, gee, sounds like this is a time that you're going to want to let your older sister know that you're newly diagnosed with breast cancer, and you just said that you don't think she's ever gone in for a mammogram and that she's 55, this might spur her on now to do that. And if you're even able to have that patient call family members and schedule them to come in and have these tests done, all the better. Also, when someone is newly diagnosed, you just have that feeling that you've lost control over everything in your life. You are paralyzed by those words that you have cancer. One of the ways that we can help patients regain a sense of control, and it does give them some control, is through nutrition and exercise. And we certainly have heard enough today regarding the issues associated with sedentary behavior and obesity. We've started some clever slogan programs at Johns Hopkins, and we're beginning with our own employees. We spend, unfortunately, more than a third of our life at work. That is our second family. And plus, we hold people captive there at work, don't we? They've come into work, they're going to be there for X number of hours, and then they're going to go home. So this is an opportunity to educate employees. And I really thought for us, when I became the inaugural director for a cancer survivorship program, I said, I want to make sure that we're taking good care of Hopkins family, also sometimes known as the mafia, Hopkins family. So slogans like, what are you waiting for? And to get out there and do power walking at lunchtime. And there are several crews now that there goes number 1, there goes number 2. They're spacing themselves out about 15 minutes apart. Caregivers and friends who are preparing healthy meals rather than bringing over the things that probably we would all love, of the comfort foods that are very high in calorie and very high in fat, but they too are helping that patient and helping that family to get healthier. And also for the caregiver to make sure that they're not avoiding their own care needs, which commonly they are, by worrying and fretting about their loved one with cancer and trying to work and take care of a family, that they can also forget their own health needs. So those individuals without a cancer diagnosis, I think it's so funny because we've heard this several times today, of people don't know what they don't know, and it's true. We need to undo myths. There's a lot of myths out there. We need to teach the facts. And we need to do it in an engaging and an interactive way. And I'm going to show you 3 ways that are successful ways in doing this. I implemented a program called a Breastival, which I never imagined trademarking or doing anything other than this one event to help out a Alpha Kappa Delta Phi, a very tiny sorority of Asian women on our Johns Hopkins Homewood campus, and their platform is breast cancer awareness. Lots of programs have been kind of test-driven at colleges, trying to raise awareness about various types of cancer. And the kids that come will come because there's food there, or because they have to, because they're going to earn half a credit for attending and then writing up a paper. I'm not in favor of any of that. I want this to be interactive. I want them to not be able to wait to get there, to not just to eat the food, but to learn. And they can't eat the food unless they earn the food through learning. So creative and interactive events with these students and willingly attending with enthusiasm and to demonstrate an interest in learning about how to improve and maintain good breast health. And this wasn't limited just to the girls. We invited all the boys too. Educating students about 8 different facts. We have 8 booths representing 8 different breast cancer and cancer organizations. They all have flashcards, true, false, multiple choice questions. When the student answers a question correctly, their breastful passport card is stamped for that booth. They have to get all 8 stamps, all 8 colors, before they are rewarded with booby prizes. What else would you be rewarded with? And it provides a mechanism for staying in touch with the student, because we ask them if you want to be reminded to mark on your calendar when you should be doing your breast self-exam. Put your email on the back of the card, drop it in the grand double D cup booby prize for our door prizes at the end. And I felt this was one of the best ways to start reducing fear. You know, students go off to college, they're now responsible for their health. They haven't been before. They also start adopting not so good lifestyle behaviors through peer pressure, whether that be smoking, alcohol, God knows what else. A lot of them gain that 15 pounds during their freshman year. All of those things are risk factors, but they don't know it. They don't know it because they don't know what they don't know. And reaching a large number of students at once. Oh, my little clicker doesn't want to click. There we go. So training students about breast self-exam, they had to demonstrate on a model how to do that. Educating students about breast reconstruction, because we learned that one of the fears that these young women had was, what would I look like if I had to have a mastectomy like my grandmother did? And we would say, let's have a contest. Guess which breast we rebuilt. Only 50% got that question right in looking at those photographs. Educate students as to proactive steps that they can take in reducing their risk, and create an event that can be replicated on other college campuses. So here's the little sorority, and they are little. There's just 13 of them, Alpha Kappa Delta Phi. And I'm just going to flip through these quickly just to give you a sense that we had over 600 students come of a campus of 1,100. And we hold this annually, and now over 300 of these have been held on college campuses across the country. An additional way to promote breast health that I have used, though I am a daring soul sometimes, I have a picture of a photo glancing at a man glancing at a woman's chest as she walks by, and the caption says, "He just checked out yours. When was the last time you checked them?" Got ducks, like breast ducts. Might be time to check them. Support your rack is a common one seen on the Houma campus. Puzzle pieces of a bra, and as you enter in your risk factors, pieces of the bra fall off, exposing your breast to increased risk. Now let's see if we can adopt and stick with some healthy lifestyle behaviors to get that pieces of those bras back on you. We've just started a 40th birthday card for actually our employees. So they get a card, has a cupcake on the front of it, and says, "Happy 40th, come and get your mammogram," which you can do during work, I might add. And when you do that, you're going to get a card for a coupon for the cupcake truck that comes by. The polyp police have also shown up. This is something I had to dream about. It's scary with the things I dream about. So I'm going to show you what the polyp police kind of look like, because they kind of look like this. This was me on Thursday at Johns Hopkins. And I go up to nursing units. I go over to the labs where those researchers never come out except to go to the bathroom. And I ask them questions. If someone looks like that they're about 50 and older, I ask them, "Have you gotten a colonoscopy?" I give them literature about it. We have a dialogue about it. And I know they're going to go home and tell other people, just like you are. I saw a woman from Johns Hopkins wearing a polyp policeman hat, which I also was wearing this morning in the Baltimore Penn Station waiting for the train. And I handed out all the literature I had, so I didn't have any to bring here. But this works because people will talk about things that they find funny. And this engages us. I have a sign that says, "Laughter is the closest distance between two people, and it is. Because when you find something to laugh about, even if you don't know that person, you've connected in an extraordinary way. So we have flashcards, just like we do for the breastivals, and it certainly works far better than just setting up a table that says Colorectal Cancer Awareness Month with a bowl of candy. Nobody's going to come over and talk about their colon. It isn't going to happen. Having magnet frames, which you get for $1 at the dollar store, and adding at the bottom of them, this is why I'm reducing my risk. Because if you aren't doing it for you, then you're doing it for somebody you love. Probably somebody that you're paying their bills and putting them through school and everything else. And we developed a certification program for lay people to be breast health educators. This was created in 1997. I presented actually to the American Cancer Society in 1998, and they endorsed it. And it's a 3-hour course, as I say, for lay people. The warning signs of a breast health problem, the value of mammography and when to begin, how to perform a breast self-exam, when to begin getting clinical breast exams, and the basics of breast cancer treatment. Many of the women that have chosen to be certified, and a few men, are breast cancer survivors. We then send them out to their local community, to their PTO, to their women's golf tournament, wherever that they are interacting with other women in the community. And they can do a 30-minute or a 1-hour presentation. They can't answer any medical questions, so they're told, that's a good question, I don't know the answer, but Lillie probably will, and then gives them my business card. I've also made a scarf. It's a very thick, it's actually in use today, or I would have had it with me, that is all different shades of tan and brown, and has in it, which I've sewn into it, little wooden beads of different sizes. Some are very little, some are about the size of a ping pong ball, and that is my polyp scarf. So people come up and I say, I'm wearing my colon today, feel it. Do you feel anything in there? I feel something too. I can't see it, didn't even know it was there, but I best get it out. Understanding the barriers to colorectal cancer screening, as I say, nobody wants to talk about their colon. We know that fear of developing cancer and medical mistrust is one of the issues associated with colorectal cancer screening. Also, the test itself, people have this image that we've got them all awake and I think are hanging them outside so everybody can look at their rear end. So I take with me an employee who's been diagnosed with colorectal cancer, and she talks about what her experience was like, and they say, gee, you look great, and she says it was caught very early. And she also talks about what it's like to have a colonoscopy, because she's on the frequent flyer list as a result of that.
Sum up, please.
Okay. Last is Undercover Agents. I almost wore this one for you, but decided to polyp instead. So picture a trench coat, hat, dark glasses, and pictures of samples of what melanoma look like. All of them say, you know, most wanted. And then I'm in search of Melvin A. Noma, better known by his friends as melanoma, who is a known killer, and that you could be living with him and you don't know it. And that these are pictures of what this looks like, and some ways in which you can get a free screening, including here at work. I'll close on the note regarding cervical and throat cancer. We do need to reach our children, and I think one of the ways is to negotiate with pharmacies, Rite Aid, CVS, Walgreens. No mother's going to take off 3 days from work to take her middle school child to get a vaccination at the pediatrician. It is not going to happen. But everybody goes to the store in the evening. Going there, I think, would be one of the ways to accomplish that. My recommendations are grant support for innovative and interactive measurable methods to conduct community outreach, employer rewards and incentives for successfully creating methods used at work to get employees screened, consumer incentives through rewards programs offered by their insurance companies, including Medicare and Medicaid, when someone gets their screening done, and incentives for colleges to provide these types of interactive awareness programs so that we can reach young people when they still are young.
Thank you. Our next speaker is Dr. Beverly Moy of the Massachusetts General Hospital, who will speak to us about reducing disparities in cancer care.